The NHS is warning of a triple-demic this winter with flu, COVID and rising emergency cases. Figures out this morning show 344 patients a day were admitted to hospital with flu last week. This is 10 times the number seen in the first week of December 2021. 19 in 20 adult, general and acute beds were occupied over the last week, with overall occupancy levels at 95%, and more than 13,000 beds a day were occupied by people who no longer needed one. This is up a quarter compared to the first week of December last year.
Yeah.
So it's down to choice. I got it because I thought with COPD and asthma, probably the wise thing to do.
Of course.
But it made me worse.
Bless you.
So it's not something I would do again, but horses for courses.
Okay, and do you live around here? Do you live in Edmonton? And have you lived here for a long time?
20 odd years.
Oh wow, okay.
And do you think that the health in Edmonton's gone downhill?
Definitely.
Yeah?
Definitely.
Do you think people take care of themselves more or not really
to be honest, I don't really look at shit like that, do you know what I mean? But at the same time, I volunteer at the Drug and Alcohol Service, so I see a lot of what's going wrong.
And do you think a lot of it's like mental health as well as
Mental health, drugs and alcohol. The lockdown really didn't help.
I had it because I felt it was necessary for me to have it.
Okay.
You know, I've never had the flu vaccine, so I didn't think I needed it. I didn't think I was going to be susceptible to influenza. But, however, COVID was quite prevalent, so, and of course you're out working and meeting people, so you don't know who you're going to come into contact with in public transport. So yeah, I felt it was a good preventive measure.
I have about everything, vaccination, flu and COVID, and I'm feeling really good and really safe.
I think everyone's entitled to their own opinion about it.
Okay, do you think...
The only reason I got it done was to travel abroad.
Regardless, tough or bad or not, yeah? It needs to get done, yes. So what you're doing for the community, yeah, makes sense, yeah? It works for me, it will work for everybody else. Maybe not so, but it worked for me. So I support Edmonton, and I'll support you for what you're doing for Edmonton. Yes, keep it moving, yeah?
It's poison.
You think it's poison?
Yeah, I think it's poison. I think there's things, God put things on this earth, like herbs, medicines, that grow naturally, and these are the things that we should be using, not man-made stuff, I'm sorry.
Do you think that it's good that we're doing projections and talking about the vaccine and doing stuff in Edmonton?
Anything is a positive step, is a good step.
Yeah.
Yeah? Would you recommend the flu jab to other people?
Yes, because I am nurse too, so I really know how important it is to take your vaccination every year. It's really good to you keep it safe.
And what country are you from?
Brazil.
But I believe, get it. I had mine done, and it's done me a favour, and it did work for me. So yeah, catch that in time.
Yeah, I've never had that, and I have to say, since I've had those, I had 2 doses of the COVID vaccine. I haven't even had, not had the third one, but I've not had a cold since either. So I haven't even caught that. So yeah, I don't know. I don't see what the problem with it is.
Sure.
And sure, I mean, vaccines are a good thing.
I can only say that I deal with mine because I have to, because otherwise I'd be dead, and you can't rely on others to help you to deal with that, especially in this day and age where you can't get hospital appointments, and you can't get GP appointments. You literally have to pester them and pester them and pester them. And I'm of the tenacity, I suppose, where I would pester until I got the appointment. But I can understand that there are people that are not of the same mindset or are not able to, sit on the phone all day and access other, people to help them.
Yeah.
And that, I think, is unfortunate.
And how do you feel about polio? Because polio is quite a big thing in Edmonton right now.
I heard that there was a bit of a sort of resurgence scare, but it's not something I've sort of
come across.
dealt with.
So do you feel like living around here, being around here, do you think people's health matters to people around there? They just don't care about their health?
I think do care about their health, but at the same time, there's many levels to it. Some people care about their health more than others. You know, like some people are more about their healthy eating. Some people think it's more about exercising. But what people don't realise is it's the thing as a whole. Do you know what I mean? It's not just like one area. It's many different areas. So like your diet, exercising, even your thoughts. You know, like your mental health is important as well.